Hello, this is my final journal for Unit 10, and I will be answering the questions. Number one, what goals did I set forth at the beginning of this semester? My main goal was to become more competent with learning some of the different types of therapy that I use with the adolescent population. I have worked with adults a lot as well as kids minimally. I currently work with adults at my job now, but I did work with the kids a few times, but I don't think that the therapy department at my job is very thorough because a lot of the kids do end up coming right back, and that's the reason why I said I wanted to learn a little bit more about that. And did I meet these? Yes, I do think I did meet these. A lot of the journal assignments that the assignments that we had, as well as the patients that I work with during my clinicals, I noticed that the nurse practitioner that I was with, she did offer a lot of different forms of therapy and recommendations for the patients in their treatment plan, and she's very good at education. So when she did give those type of therapies she wanted the parents to use for those children, she did also go into depth and discuss what they consisted of with the parents. So I did feel like I learned a lot. The next question, my feelings, prejudices, or biases that I experienced. I didn't have too many biases at all. One particular thing I would say is working with some of the kids who had assessments who had been sexually inappropriate. I had one particular young man who was being sexually inappropriate with a little girl in school. He made some sexual comments and he also touched her. And I will say for me that is a personal trigger because of some trauma in my childhood with a family member who did have some sexual abuse. And I do think I handled it professionally, though. I kept a good poker face. I was very professional. The family and the child would have never known that's how I personally felt. And, you know, that is the professional thing to do. So I do feel like I took care and handled that bias professionally. Next question, how did I manage my anxiety and self-doubt or uncertainty? I didn't have too much self-doubt or uncertainty, I don't think. I felt like the nurse practitioner that I did my clinicals with, she was wonderful, and she did a lot of conversating prior to we had the assessments with the patient. She would discuss the patient first. So I kind of always knew what we were going into before we started working with the patient, and I felt like that was a great help. So I didn't have too much anxiety or issues when it came to clinicals in this semester and the assignments that I had. Next, what understandings or insights did I develop during my clinical experience? I would just say education. I feel like that is great, and I feel like the preceptor that I had was very good at educating her patients as well as educating the students that she worked with. And I feel like that is a major part of any type of patient assessment. If you're going to talk to the patient and you're going to give them these medications, and if you're going to offer these forms of therapy, you should be able to properly educate them on those things. So I just feel that it's significant and important for the nurse practitioner to first provide that will receive the education that they need. So that's why it's important to continue your training even after you become licensed and become on your educational track. And has reflective practice impacted me personally as a student and provide? Yes, because a lot of times I don't think we quite understand how a certain situation or a certain patient may affect us or make us feel personally, or even make us feel on a professional level. And I feel like us having to go back and answer those questions and the reflections every week, and find a specific specific patient interaction to talk about kind of made us more aware of what we may not have been aware of about ourselves. So I do think that the journals are very, very significant. I enjoyed the journals, as a matter of fact. I enjoyed them every semester, and I do plan to incorporate those into my future practice as well as education. I would like to one day be able to also be able to precept students when I am licensed, and I want to be someone that can help somebody else as they get to their next step in life and next step educationally. So I do prefer using the journals in school, and also educating others about them so they can use them as well. And everything overall was a great experience. I enjoyed the class. I enjoyed everything that I learned about the class. I also enjoyed my preceptor and all the education that she provided, and how great and professional and educational she was with all of her students. Thank you.